Hey guys, happy Saturday. Welcome to my channel, Medical Assistant with Miss K. Thank you guys for tuning in with me on this Saturday. Do me a favor as you come in, let me know what city and state you are watching from. I'm going to go ahead and get started. Just a heads up, it is storming where I am, so you may hear some thunder in the background. I'm just praying I don't lose any power or anything, but it is storming right now. I contemplated on doing this later, but I said, let me go ahead and do this now because I have some other things to do later. But anyway, let's go ahead and get into this. So we're going to go over some medication classification. Well, actually some medication examples. In another video, we already went over the classifications where you had to know the difference between antiemetics, analgesics, NSAIDs, and things like that. So make sure you check out part 1 if you want to see a more detailed list. So in this video, we're just going to go over some more examples of some common medications that you'll need to know, as well as the pronunciations of those medications. Okay. Hey, Jeannie, I'm glad you're catching me live as well. Welcome. All right, guys. So for those of you that don't know me, my name is Kendra, aka Miss K. I'm a medical assistant instructor. I've been a medical assistant since 2004 and a medical assistant instructor since 2011. I help medical assistants and future medical assistants pass certification. You guys know I have my online study guide, the medical assistant refresher course. We got the clinical version, which includes both clinical and administrative. And then we have the administrative version, which is admin only. Okay. There's lessons and quizzes within the study guide. So you can find that at marefreshercourse.com, or you can just, click on the link in the description box. So let's get into it. I do want to remind you guys what the therapeutic use is, or indication for use. This is what medication is used to treat. Okay. The mechanism of action is what it is doing inside of the body, how it works. Is it blocking receptors? Is it activating receptors? Right? Is it so that's part of the mechanism of action. And then the legal class refers to whether a medication is prescription, available only via prescription, over the counter, or whether it is a controlled substance. All right, what is a generic name? Generic name is the official non-branded name. An example is ibuprofen. Ibuprofen. The trade name of ibuprofen would be Advil or Motrin. The chemical name is the scientific makeup of the drug. It describes the structure of the drug. Okay. All right. Let me see something. Hold on one second. Okay. All right. I had to fix something. All right, guys. So let's get into it. Let's get into some examples. All right. So first we have Nexium. Nexium is the brand name. The generic of Nexium is esomeprazole. The classification is PPI, or proton pump inhibitor. And the action of that is to reduce stomach acid production. And it is used for patients with GERD, ulcers, and acid reflux. Next medication is Prevacid. Prevacid, the pronunciation for Prevacid is lansoprazole. The classification is PPI, or proton pump inhibitor. It suppresses it. The action is that it suppresses gastric acid secretion. It is used in GERD, ulcers, and heartburn. Next medication is Inderal. The generic is propranolol. And guys, I want to just remind you guys to notice the pronunciation is there to help you guys pronounce it correctly. Classification is a beta blocker, and that action, it decreases heart rate and blood pressure. The use is for hypertension, anxiety, and migraine prevention. Next medication, Procardia. The generic pronunciation is nifedipine. Classification is calcium channel blocker. The action, it reduces blood vessels. It relaxes blood vessels. The use is for hypertension and angina or chest pain. Next medication is cardizem. The generic is diltiazem. Classification is calcium channel blocker. It slows heart rate and relaxes vessels. Used for hypertension and atrial fibrillation. Next medication, Vasotec. The generic is enalapril. Classification is an ACE inhibitor. It inhibits an angiotensin converting enzyme, which is a hormone that tends to restrict or constrict blood vessels. So one thing I want to mention too, when you see inhibitor, when it comes to classification, this means that it is restricting or preventing something. Okay, so in this case, it is preventing the angiotensin converting enzyme from constricting the blood vessels. It actually relaxes the blood vessels and used for hypertension and heart failure. Lotensin is the next medication. The pronunciation of the generic is benazepril. The classification is an ACE inhibitor. How does it act? It lowers blood pressure by relaxing vessels. It is used for patients with hypertension. Next medication, we have Diovan. The generic is valsartan or valsartan. Classification is an ARB or angiotensin receptor blocker. It blocks angiotensin 2 receptors, used for hypertension and heart failure. Next medication is aldactone. Pronunciation of the generic is spironolactone. The classification is a potassium-sparing diuretic. The action inhibits sodium reabsorption and is used for heart failure and fluid retention. Catapres. Catapres, next medication, the generic is clonidine. The classification is alpha-2 adrenergic agonist. The action is it lowers sympathetic outflow or some of the activity of the sympathetic nervous system, okay, and is used for hypertension and ADHD. Now, one thing I mentioned when you see inhibitor or inhibits, that means that it is refraining, it is preventing refraining as well, or preventing a certain hormone or enzyme in the body. When you see agonist, this means that it's actually stimulating a certain receptor or a certain hormone. Okay, so agonist is actually stimulating it. And then if you see maybe antagonist, that means it is working against that receptor or against that hormone. Clonidine is used for hypertension and ADHD. Next medication is Imdor. The pronunciation of the generic is isorsabide mononitrate. The classification is nitrate. How does it work in the body? It dilates blood vessels and it is used for angina prevention. Nitrostat. The generic is nitroglycerin. The classification is nitrate. How does it work? It relaxes vascular smooth muscle and it is used for acute chest pain or angina. The next medication is Zetia. The generic is ezetimibe. The classification is cholesterol absorption inhibitor. The action, it inhibits intestinal cholesterol absorption or inhibits inhibits cholesterol from being absorbed in the intestines. It is used for high cholesterol. Crestor. I told you guys, I told you guys in the last lesson, statins, you'll notice some medications, you'll be able to know exactly what it's for. You guys know that statins are cholesterol medication. This is rosuvastatin. I think so far we've gone over atorvastatin, simvastatin, lovastatin. This here is rosuvastatin, the cholesterol medication. It inhibits HMG-CoA reductase. The use is high cholesterol or cardiovascular prevention. Mevacor. Oh, this is lovastatin. Okay, so we're just going over lovastatin. I just mentioned we've already gone over it, but this is lovastatin here. Cholesterol, as you guys know, it reduces liver cholesterol production. It is used to treat high cholesterol. Humalog. Humalog, generic is insulin Lispro. Classification is rapid acting insulin. What is the action? It lowers blood sugar quickly after meals, and it is used to treat type 1 and type 2 diabetes. Novolog, also an insulin. The pronunciation of the generic is insulin aspart. It's a rapid acting insulin, and it promotes glucose uptake into cells and is used to treat patients with diabetes mellitus. All right, Actos, pioglitazone is the generic. The classification is diazolidinediones. That's a long one, right? Diazolidinediones. I had to look that up, guys. That pronunciation is diazolidinedi. I'm sorry, I'm saying it wrong again. Diazolidinedione. There it is. Diazolidinediones. I had never actually seen that word before going over this one. The action is it increases insulin sensitivity, and the use, it treats type 2 diabetes. Glipizide. I'm sorry, Glucotrol. Glucotrol is the brand, and then glipizide is the generic. Classification is sulfonylureas, and the action, it stimulates insulin secretion. It is used for patients with type 2 diabetes. Diabeta. Diabeta, the generic for diabeta is glyburide. Classification is sulfonylurea. The action, it increases insulin release from the pancreas. It is used for patients with type 2 diabetes. Amaryl, pronunciation for the generic is glimepiride. Classification is sulfonylurea. Action, it stimulates pancreatic insulin release. Is used for patients with type 2 diabetes. Januvia is the next medication. The generic is sitagliptin. Classification is a DPP4 inhibitor. It increases incretin levels. The use is for patients with type 2 diabetes. Invokana, canagliflozin, canagliflozin, sorry, but is the generic. Classification is the SGL2 inhibitor. It promotes urinary glucose excretion. It is used for patients with type 2 diabetes. Empagliflozin. I'm sorry, Jardiance. Jardiance is the brand name. The generic is empagliflozin. The classification is the SGLT2 inhibitor. It reduces glucose reabsorption in the kidneys. It is used for type 2 diabetes. Victoza. Liraglutide is the generic. The classification is GLP-1 receptor agonist. It stimulates insulin secretion and delays gastric emptying. It is used for patients with type 2 diabetes. Okay, guys, so this is it for now. I have done parts 1 and 2 already. This was part 3, guys. Let me know if this has been helpful to you guys. I will do part 4 either tomorrow or Monday. Let me know if you guys have any questions. I see some of you guys have let me know you passed your certifications in the comments. Congratulations to you guys. Let's see. And good luck to you guys that are about to take your test. I see that some of you guys say that you are preparing to take your test, so good luck to you as well. Um, yes, the category is the playlist is ccma practice exam. So even though it's ccma practice, the information is good for all of the certifications as well, because they ask all of the same type of questions. So even if you're preparing for CCMA, RMA, CMA, AMA, AMCT, AMCA, they all ask the same type of questions, guys. So just remember, you can check my online study guide out at marefreshercourse.com. The link is also in the description box. And yes, this is good for nursing as well. So I get students that come to my channel that are also nursing students as well. So yes, even though the scope of nursing is, of course, much wider than medical assistants, when it comes to things like this, medications, this is something that we both need to know. We need to know as medical professionals, as a whole, being familiar with common medications is very important. Um, Now, one thing I will say when it comes to some of the things we went over, I gave you guys, some of the actions in the body and things like that. Some of that you may not have to really get into in your field. However, when it comes to the test, when it comes to medication, when it comes to medical assistant certification, or when it comes to, taking your test as a nurse, taking an NCLEX, you may have to know, like, the specific classification and action for those type of tests. But when you're in the field, well, I don't even want to say, I don't want to speak for nurses, because they're, like I said, the scope is wider. Nurses can advise and assist with diagnose and assessing and things like that. So I don't want to speak for nurses, but definitely for medical assistant, when it comes to the actions and things like that, we don't really get into that in the field. But you do need to be familiar with the medications and the generics, and also know what they're used for. So when you get patients coming in, you're reconciling their medications, going over their medication list with them, and they're telling you, well, this, I take this medication, I don't know what it's for. You want to be able to tell them, oh, this is for your blood pressure, right? Or, this is for your cholesterol. So this is why it's important to be familiar with what medications are used for, and also knowing how to pronounce them. There's so many medications, as you can see, even going through this, some of them I kind of tripped over a little bit, because it is, when it comes to certain generic names and certain classifications, a lot of it is hard to pronounce. But this is why, practice is so important. Making flashcards with the generic and with the generic on it, the brand name, as well as the pronunciation, right? And then maybe on the other side, having what it's used for, the action, maybe even some of the precautions and contraindications, side effects and adverse reactions. Now, we went over that in the first video, the difference between all of those things. Not in this video, but that's also something that's important to know, and that you may have to know for certain tests as well. But anyway, guys, I'm going to go ahead and let you guys go. Thank you for hanging in there with me on a Saturday morning or Saturday afternoon. I hope you guys have a great day. It is storming here in DC. I don't know what the weather is like for you guys, but it's wet and cool here. But anyway, guys, you have a great day. As far as externship, yes, I have a playlist for externship tips on my channel as well. You guys have a great day. Be blessed.